Hi, my name is Anna Lyon, and in this presentation you will learn about wellness and how it relates to diabetes and obesity. What is wellness? According to the World Health Organization, wellness refers to an individual or group of people that are at an optimal state of health. An individual that is physically, psychologically, socially, spiritually, economically, and whom can fill the necessary expectations within the family, workplace, and community are considered to be well. As you can see, the chart to the left shows the 8 dimensions of wellness. Emotional wellness is relating and understanding your feelings and how to cope with stress. It is important that you take care of yourself, relax, reduce your stress, and understand how to grow from your experiences. Environmental wellness encourages a person to balance between yourself and the environment. You have the ability to show respect for other living things in our environment and understand that it is important as respecting the physical environment itself. Intellectual wellness refers to having an open mind when you come across new ideas and continuing to expand your knowledge. It also encourages you to be more active in scholastic, cultural, and community activities. Financial wellness is knowing how to manage your financial expenses successfully. As most of you may already know, money plays a critical role in our lives. Financial stress is one of the most common sources of stress and anxiety for college students. Occupational wellness is simply enjoying what you do for a living and appreciating the contributions that you give. This encourages one's personal satisfaction in life through work. Physical wellness is maintaining a healthy body and getting care when needed. This is possible by getting proper exercise, eating well, sleeping enough, and knowing the signs of illness and getting help when needed. Social wellness is another dimension and helps a person perform social roles effectively and comfortable. It also allows someone to develop relationships with peers, as well as intimacy within relationships. Lastly, spiritual wellness allows a person to develop values and seek meaning and purpose in life. This can be done in many ways, including religion and relaxation. It also means to know how to cope with issues that may arise in everyday life. Obesity occurs when your body has an excessive amount of body fat, eating more calories than necessary. An individual with a body mass index, or BMI, that is greater than 30 is considered to be obese. Over 1/3 of Americans are obese. There are also several health risks that are associated with obesity, one of the most common ones being diabetes type 2. Others could include heart disease and high cholesterol. The map on the right shows the obesity trends in America in 2015. Looking at this map is really unfortunate. There are so many states that have such a high obesity rate. I think this is all attributed to the amount and convenience of fast food restaurants and how affordable unhealthy food is. Some factors that can affect your weight are genetics, overeating, eating high-fat foods and foods that are high in sugar, the lack of being physically active, and stress. So what exactly is diabetes type 2? Diabetes type 2 occurs when insulin is not used properly within the body. It is determined where fat is accumulated and where there is an increase of upper body fat, meaning the midsection of your body. The chart on the right are some of the common indicators that can lead to diabetes type 2. Insulin resistance can sometimes be hard to grasp. So to simplify that, it simply is when you eat food, you make insulin. The cell will resist the insulin. Sugar is then stored as fat, and you will feel fatigued and hungry. The process then will start over. Prevention is important and is something that everyone should understand no matter what the disease or condition may be. One way to prevent diabetes is by weight loss. Losing anywhere between 5 to 10% of your weight can delay your risk of diabetes type 2. Another great way is to completely change your lifestyle. This can be done by dieting, so watching your carbs and sugar intake, as well as adding moderate to intense physical activity such as walking, jogging, and lifting light weights. If you are a diabetic already, some suggestions to help lower your blood sugar could include choosing foods wisely, regular exercise, lowering stress levels such as meditating, yoga, walking, and last resort would be to add medications to sensitize the body to insulin. Ways that I would help prevent obesity would begin with not having as many fast food restaurants in one general area. This is something that I never understood. We wonder why obesity and diabetes are a global issue. I believe there should be healthier restaurants to have a drive-through window so families have the option of making a better choice. Work, sports, activities, etc. sometimes force people to grab a meal on the go. If people have healthier options that were quick, like McDonald's, for instance, then I believe this could reduce the risk of obesity along with diabetes. I also think gyms and personal trainers should be more financially accessible to the public. Given that people could afford to work out and hire someone to train them, could also lower the risk of obesity and diabetes.